Welcome, everybody. My name is Dr. Sarmen Sarkissian. I'm a hematologist and oncologist, and I'm on the board of the Armenian Medical Society, and proudly I'm the chair of the Membership and Mentorship Committee. So mentorship is something I'm very proud of and passionate about, and I put a lot of effort into making sure we have a really strong mentorship program. We do live events where we have our peers get together and really help out the next generation of pre-health students. And a couple months ago, we dedicated ourselves to starting an interview series where we interview students all along the path until their professional career starts to get planted. This includes students who are currently in undergrad, those who just graduated, taking their standardized exams, those in professional school, and as well as residency and fellowship. So today I'm very lucky and very lucky to have Margarita Hovsepyan here, who is currently in dental school. So Margarita, if you can introduce yourself, and we're going to have a very lovely interview.
Yes. Hi, everyone. My name is Margarita, and I'm currently a second year dental student at UCLA. I went to UCLA for undergrad as well, and I studied psychology there.
Very good. So, let's go back a few years. You graduated from high school, you're in undergrad, you probably had some inkling to do something healthcare related. How did you pick dental school versus, say, pharmacy school, or medical school, or any of the other pre-health professions?
Um, yes, as you said, Dr. Sarkissian, I knew I wanted to do something in healthcare, and I knew I wanted to work with patients. And I became a scribe working with some physicians. And I just did not see myself working as a physician. I did not like, I didn't like the atmosphere in a hospital. And when I shadowed some dentists, I really liked the environment that they work in. I like the way that dentistry is structured. It's more of a skill that you get better with as time progresses, rather than anything too heavy and complicated prob- problem solving. So I really like that. I like that no matter what patient that walked in, you could help them and you could like help them that same day. Um, so that's why I picked dentistry.
Yeah, you really bring up an important point. I mean, sometimes I ask myself, and in medical oncology, sometimes I'm seeing patients who have very advanced disease. There's no cure. They're suffering, and sometimes they're young or their family circumstance is so complicated, and it's inevitable to feel helpless. And I think for some people, depending on their personality type or how often they see that in their profession, they get used to it, or maybe they don't. But you pointed out something. You said you just didn't want to perhaps be in situations where you felt like that. You wanted to have more, um, a higher percentage of your interventions being successful, correct?
Exactly.
And
And
that's
also
important to,
dentistry, sorry to cut you off.
yeah, and that's
Dentistry,
important. You recognize that early on.
yes. Yes. Dentistry also, besides that combination of patient care, the way the whole profession is structured, it's also there's an artistic component to it. And as you guys can see, I love art, and so I wanted to be in a profession that has that artistic, hands-on component to it, rather than more treatment diagnoses that aren't as direct.
And I had a reciprocal reaction. I actually went in thinking I would like surgery into medical school, and then I realized I didn't really enjoy anatomy. And when I did my surgery rotations, I didn't really enjoy being in the operating room or some of the downtime you had to do. And it was a very stressful time. I said, I can't believe I'm not liking this. And then as soon as I started internal medicine, I said, hey, you know what? This is a better fit. 4 weeks, I was convinced. I did backtrack when I somehow ended up in an anesthesia rotation, but then I said, no, just stick with your heart. And, I've been very, very happy since. So what wisdom could you provide some of these undergrads that are, they know they want to do something healthcare related, but they're thinking, maybe I want to do pharmacy, maybe I want to do dentistry, maybe I want to be a clinical psychologist or a physician. What would you impart on them?
Well, you kind of answered this yourself. You won't really know what you want to do until you get exposed to it in some shape or form. So I really recommend that everyone shadows shadows whatever profession that they're interested in, really reflects on not only is this quote unquote a good job, but is this something that I see myself doing for the rest of my life? Is this a good job because it combines my strengths, my interests, um, or is it a good job because I've been told that by my friends or by my family? And I think you have to be really honest with yourself. Otherwise, you might follow a path that long term is not fit for you. And when I was just going through my personal reflections on what do I want to do, how do I want to, what do I want to contribute to the world, um, I realized that there were several careers that I could see myself succeeding in. Um, but what made me choose dentistry was that whatever profession that you pick is gonna heighten certain character traits in you. And if I was to pick, let's say, law, I knew that to be a successful lawyer, I would need to become a little bit more argumentative, more of a critical thinker, and that's not the character trait in me that I wanted to heighten long term. So um, I think everyone needs to number one have genuine faith that they can they can do anything, and no matter what career they pick they can succeed in it if that's their goal, but what type of person do you want to become to be successful in that field? And that helped me, that was the question that I asked them, ultimately um, made me like solidify my decision in dentistry.
Yep, very nice, very nice. So, you obviously did very well at UCLA. You got into a very esteemed dental school, and we're all very proud of you. Now that you've sort of gone past that hurdle, what are some of the things that the admission committees are looking for? And admissions committees are very good at getting dental school students involved in,
Mhm.
looking at applicants and perhaps interviewing them. What do you think now that you're on the other side creates a proper applicant?
Um, the thing that there's the standards like your grades and your scores on the standardized testing. Um, to be a competitive applicant, you need to fulfill or you need to fall within that range that the school has. That's a given, no matter what school you look at, no matter what you're trying to pursue. Um, but in terms of filing your application and the way you present yourself to the admissions committee, you have to you have to think of it sort of like a business transaction instead of um, instead of convincing them of your love for the school, as in, I really want to go here because you guys are amazing. You have to instead go at it with the point of, I want to go here, and you guys would like it if I was here. And the way you do that is by showing that you've researched the school, that whatever, like, that you have some sort of mission and you have a long-term goal that so that the admissions committee has a vision for once if they were to admit you, who would you be in that school and what would you do, what type of alumni would you be. You have to convince them either one, you're gonna come back and contribute financially to the campus, or be very involved with their research and maybe discover something that could make the school famous long term. So um, approach the application process from a position of strength and confidence, not necessarily like narcissism, but just self assuredness and a calmness. And this will carry through in your during your interviews too. It's overall just a um, it's they have to like you as a person. So be yourself, be professional, know what you want. This is where self reflection comes in, and um, really convince them that you're I'm going to be a valuable asset to your school.
Absolutely. One thing I think a lot of people won't realize is that when you get into these healthcare professions, just like others, especially when you get into a small niche, it's a very small group of people. You'll hear the same names over and over. And all of a sudden, you could be a fresh graduate from dental school and you're technically a colleague with someone who's 30 years senior. So, these professionals want to make sure they're bringing in the right people into their ecosystem. And people take a lot of pride in their school. They never want to see their school and their degree as just some business transaction. Student has the money and the grades. Here's your degree 4 years later. They want to take pride in their graduates. Especially the California schools. You're getting such a massive discount compared to some of the private schools that they're doing you a big favor by letting you in there. You get to live on the coast. The weather is nice. You're around some of the smartest people, so you want to convince them that, hey, you know what? I really know your value and I want to tag team on this, 30-year mutual relationship. So with that being said, let's go back a little bit to undergrad, the DAT. That's a tough exam. It's not intuitive for a lot of people. There is the 3D component. Unless somebody really starts practicing standardized exams early on, it may just hit them as a shock. What was your approach? Did you start to study early on in your first couple of years? Did you wait until you graduated? Did you find the test to be pretty natural for you? What do you think?
It didn't come naturally to me, but because I decided on dentistry a little further down in undergrad, it was my last year actually. It was my last year, fall quarter, that I decided I was going to pursue dentistry. So I had sort of a short window to apply, and I knew that I could just wait a year and then like study for the test. But I just signed up for one of the prep programs. I personally use DAT Booster. There's also boot camp, and they're both amazing resources. The people that made them know how the test works. They know what type of questions to ask you. And during my actual test, I had several questions from Booster directly. And I signed up for it in December 14, and I took the test. I signed up for DAT Booster on December 14, and I took the test February 14. So exactly 2 month window between me starting studying and taking the test. And I found that to be the perfect amount of time to study. If it was anything a little bit more, I know that I would have started forgetting some of the information. But everyone studies differently. Everybody has different ways of studying. So just sign up for one of the programs. That's really all you need for dental school, and they will lead you through the process. They also have a calendar system where you put your test date, and they tell you exactly what modules to do on what day. So that was really helpful. Overall, I would just say focus more on taking the practice tests and the practice problems that they give rather than just passively studying content, because I learned most of the content by the questions that I got wrong when doing the practice problems. So really focus on those, review every single answer choice, and understand why that was the correct answer choice and the other one was not. So you should be familiar with all the terms that pop up.
Very good. Yeah, I remember I definitely had some difficulty transitioning from undergraduate thinking to the MCAT. But now that I'm, a full-fledged physician, I do have a better appreciation for the processes because undergrad tends to be a bit, theoretical. And it's fine taking exams and sort of applying it. The standardized tests tend to be even more applicable because you're not getting input from one professor, you're getting probably 50 or 70 different authors on a single exam. So that's sort of real world in action. And, later on in my personal career, I went from studying for these to developing my own study methods. And then ultimately, I actually have a couple of my own question banks where I wrote my own questions and flashcards. I think just between the two, I have something like 4,000 multiple choice questions and 15 or 16,000 flashcards that I've built over, years and years. But that's just sort of one way someone could think about ownership. You can go from theory in the class to level one application, the professor's exam, level two application, a standardized test written by dozens of authors, and level three, why don't I write my own questions and exams and possibly my own review book? That's when you really come to own the material from different angles. But no one has to take it, to that extreme. Okay, so now, you made a very mature decision. You found what you like. You studied for the exam. You did very well. You got excellent grade. You got into a good school. Professional school is really different from undergrad. What do you think so far? How does it feel?
Um, Definitely it's everything's just a lot faster, and it's a lot faster. There's a lot to study, and besides the studying, there's a lot of practice that you need to do outside of class hours to get um, just good with your hands. It's another. Com- it's one thing to know how to study, which is like what we prepare for in undergrad, and then it's a whole nother thing to figure out how to like look inside like a tiny hole and like get used to these really tiny measurements, and just like it's a whole different world just inside the mouth. The way you hold your burr, every single tilt makes a difference. So that's that's wholly different from what you learn in the classroom. UCLA is known for its didactics. We have a very challenging curriculum, but because everything we learn is applicable to what we're going to do in the future, it's just, in my opinion, easier to study because there's, it's just more meaningful. While in some of my undergrad classes, I was just taking a lot of classes just to fulfill criteria to graduate. So it's challenging, but very doable. You just have to get used to um, your threshold for what you can get done in like an hour and 2 hours really increases from undergrad to graduate school.
Yeah, I remember really having that stark contrast, and it took me definitely a few months to sort of recalibrate my brain and how I studied and the intensity. Another thing that I found interesting that I want you to comment on is all of a sudden, in undergrad, you're taking all kinds of different classes, you have all kinds of friends, and you probably have some pre-dental friends or pre-med friends. All of a sudden, you go to professional school and you're like, wait, it's all dental students.
Mhm.
So what is it like being around your peers that are all in it for the same exact reason?
Mm. um, I like it. I like it because number one, my classmates are brilliant, every single one of them. And it's really stimulating just to go to school with them, see them every day. They're all interesting outside of school too. So it's not just dentistry that comprises like our whole identity. And it's also very uniting that everyone has this one shared common goal and interest. And because we're already in school, the level of competition is different. So you're more relaxed with each other. Everyone is just more friendly. The faculty are really, really, really involved in your education, which is not something that um, I experienced in undergrad. Like all our professors know that we will have a test like a week from now, and everyone's really like really collaborating with each other, all the deans, all the faculty, all the class representatives. So it's 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 just it's a really stimulating environment to be in, and I'm very grateful to be studying with my peers and to be in the school that I am.
Yeah, absolutely. You're bringing back some good memories. I mean, I have such an amazing network of friends that, where our friendships were forged in medical school. And, 15 years on, we're still, on our group text every day
That's
titled,
amazing.
that's what we're called. So very good. Well, with the fun and the passion comes challenges, the blood, sweat, and tears. So tell me about some of the tough parts of dental school.
The toughest part of school is not necessarily our classes, even though our classes are really hard. You just get used to it after a certain point. For me personally, even though our school is very collaborative and everyone is very friendly with each other, the hardest part is just that that competition that exists between each other. And it's not the same competition that exists in undergrad. This is more because everyone is so ambitious, so type A. Whenever whenever you see them, like we are all assigned the same classes, where in every single class is the same. The way you see everyone spending their time, and whenever a challenge comes up and someone is, let's say, very anxious or stressed out by it, it becomes like a collective anxiety, and everyone just like um, builds off of each other. And I think that's the hardest part, not letting that infect you, and not letting it not infect you, but just affect you, so that you can have your own boundaries for this is when I'm going to study, and just because this person has done all of this before me, that I'm going to be okay. I think that's the hardest part. Classes again are really hard, but you sort of just get used to it after a certain point, and you get used to the amount of classes, amount of tests that you're taking.
Yeah, as you know, you bring up, really good memories, and I really think differently about that, as I've gone through it. One thing everyone will realize is that healthcare is a 24/7, 365 enterprise. There's an infinite amount of healthcare that people need, in particular, society needs. There's future problems that need to be solved. I rounded in the hospital yesterday, this morning, and whether I'm rounding or not, the amount of patient needs never ends. So I think people have to think about, it's nice that there's competition and overachievers, but I think it's best to realize that this should be a humbling experience. I think it's wrong to try and compare yourself to any other particular person. You never want to try and size up anyone or anything like that, or feel like you're getting sized up. But it's best to look at an array of people and seeing the interesting things they're doing. Maybe someone's a really quick decision maker in clinic, and you could learn from them. Maybe someone has really interesting study habits or memorization techniques. So everyone is bringing something really interesting to that competitive table, as I would call it. So rather than seeing it as a threat, think of it as, not for you, but think of it as a learning opportunity. Think of it like a creative module, like if you went to a museum, you wouldn't think of all these artists, creations as your competition. You would say, oh, wow, that's just an interesting way to do
Inspiration.
that.
Yeah.
That is the best way, and that's what I love about any sort of competitive environment. It just helps you grow, and the entire system benefits from it. So, but again, so coming back to you, I mean, you talked about some of the fun parts, about the education part, some of the tough parts. Now, how do you take a breath and relax? As we said, 24/7, 365. You can't be in the lion's pit battling the lion all day, right? What does a margarita do to relax?
um, Anything that just gets me out of my head and just into my body. So any type of movement, from running to dancing to just taking a walk. I don't think almost there's little that like a 10-minute walk can't fix. So that's probably my favorite way to relax, just to spend time with my family and friends as well, of course. Spend time in nature, read, paint. There's a lot.
Yeah, and I think you definitely need those little breathers, because take a break, relax, and then go back and battle it out. It's I think one of the best ways to think about healthcare, it's not a job, it ends up being a little bit of a lifestyle. And I think the day it turns into a pretty square job is, you perhaps are not you are becoming square yourself.
Mhm.
I mean, just within dentistry, I mean, there's so many problems that need to be solved. A lot of preventive measures, people with poor socioeconomic backgrounds, oral health has a lot of bad downstream complications. I mean, a lot of the patients I take care of, I don't have time to, take care of any of their dentistry issues, and just getting them plugged in with the right people is already a challenging, and that affects what I do as an oncologist or a hematologist. So I think it's best to sort of find humility in the fact that we can't solve every patient's problems, and we can't solve all of society's healthcare problems. So you take a reprieve from that. So I think with that being said, any pearls of wisdom for the next generation, Margarita? We're very proud of you. Our next um, the next generation of Armenian youth doing very well, and I could see the passion. Any pearls of wisdom for some of the high school students that are ready to hit college or those in college?
Mhm. Pearls of wisdom. I would say that whoever's in high school, whoever's in undergrad, even anybody in graduate school, um, it's amazing that we have the opportunity to learn, that we're given the freedom to pursue anything that we're interested in. And no matter what you pick, no matter what you're interested in um, or not, they can all contribute to society in a helpful way. And life is really so beautiful. People are amazing, and anybody is capable of literally doing anything. So have trust in yourself, have faith in yourself, um, k- keep your family and your friends close by, and pursue just authenticity in whatever you do. That would be my.
I agree. I love those parting words, because I think the grind, as people call it, trying to get into professional school, it can make people feel inauthentic because it can feel like an assembly line, and you feel like, oh, how do I distinguish myself? You bring up a good point. Don't ever lose that authenticity, especially around those very fragile family and friends that you have very delicate relationships with. None of those should ever be hampered by, the lion's pit, as I call it. Very good. Wonderful, Margarita. Well, we really thank you for your time, and you know, thank you again.
Of course, it was my pleasure.
Yeah, my honor. Bye bye, everyone.
Bye.